This post introduces the Canadian Forces officer selection system through the mandate of the Air Cadet League, and we can see the issue is to resolve problems arising from implementation of policies, understanding the roles of D&D, and resolution of problems that develop through the aerospace medical capability. And this would be the physicians in support of cadets going on from glider standards on to the higher levels. So we can see these two columns side by side are problematic because CF is looking for motivation towards the Canadian Forces, leadership skills, teamwork, and particular conformity to rules. And that's a snag through Judge Birch's meds as directed, because we have to meet the standards while at the same time doing this through the medical care available, and what effect this would have on the status of the member. So FACT's efforts led to this mess in Tacti's transcripts and Curtis Wood's advice to remain on his intervention. He's not a CAMI and has no ability to lift a flight ops restriction anyway, and neither did Dr. White. So through 42412 reconsideration, we're drawing eyes onto iCharts and also the Fathers for Justice movement through the custody and access arrangement and such, with the mission of the Transport Canada Aviation Medicine to ensure pilots are fit, and that would be free of the effects of any of these meds, while concurrently drawing eyes onto the objections to the psychiatric industry, such as it is in forensic psychiatry. And as can be seen, this is simply not the viewpoint of the applicant, but an industry-wide observation on the status of that profession. So this would be a look at Form 2610 following a considerable period, and defense research where they do the flight surgeon training for D&D's providers, and they would go on to get authority to conduct medical exams for the air cadets and members of the CF. So Gender and Flight Sim draws eyes onto Drs. Bach and White and Wright as well, with the CAMI wings drawing eyes onto PLTS references that are applicable to the physicians themselves. So we'll just close with a look at a 233 on departure from Cassidy, where the author got my glider's call in 79, and it would be obvious the cadets send their applicants to a CAMI for a pre-course medical, and the same medical standard would apply to the adults as well. So has a pilot in the front and CAMI on the team for 418 Squadron elsewhere. And that basically is just simply contesting Wood's efforts as a random artifact of the St. Albert Provincial Bench.